Melissa Fuller with Shape of the City, and today we're going to be talking about the Nebraska Physicians Cancer Screening Project, and we are with Drs. Bob Rauner and Dan DeFreece. Welcome. Tell me, how did this project get started?
It started here in Lincoln after a meeting where we had a presentation by Dr. Ali Khan, who's the Dean of the College of Public Health. One of his health priorities for Nebraska was that Nebraska has higher colon cancer rates than the rest of the country, but at the same time worse screening rates. So if we want to prevent it, we need to fix that problem. And so we started assembling kind of a group of Lincoln clinics to start working on this, and it kind of grew beyond Lincoln and went outside of Lincoln, so we renamed it the Nebraska Physicians Cancer Screening Initiative, not just Lincoln. One of the early clinics outside of Lincoln to jump on was Dan DeFreece's clinic in Nebraska City.
And talk about what is the mission of this project?
Yeah, well, it comes off of, there's a national effort called 80% by 2018, where they want to try to get 80% of people screened for colon cancer by 2018. And so we started a couple of years ago with that goal, and every clinic kind of set their project to try to get there. And quite a few of them actually made it by 2017, so we'll see if a few more get there this year, which obviously 2018. So.
Well, talk about how does this work? What are you guys doing? Talk a little more about the specifics.
Well, most of the time in clinics where we spend our time just seeing patients, patient after patient after patient. So this is a little bit different project for clinics to look at patients as a population and to reach out to them to try to make sure they get the test done they need. And of course, we focused on the breast cancer and the colon cancer screening part of that. So it was actually setting up a process in our clinic to identify people that either needed to have their screening done or hadn't had that done, and reach out to them to help them get that process done.
Perfect. And how is a project like this funded?
Well, we started out with basically grant funding. So we asked a few people to kind of support the effort and pay for the educational portion of it. And we had grant dollars from CHI St. Elizabeth's funded some of it, Nebraska Medical Association, Blue Cross Blue Shield of Nebraska, and Copic Medical Foundation funded it.
And what have you guys learned so far? Where are you guys at?
Well, it's been a very interesting process for our clinics because they had to actually sit down and develop a project and work through that project and assign people to do that. So what we've learned is we can do it, and we can make a big difference for our patients in Lincoln and the surrounding areas. So this project then is going to lead to other projects to help improve the health of Nebraska, basically.
Yeah, I think also the clinics took a look at their entire population, where a lot of medicine, it's always one-on-one. You come in today, here's what do you need today, and that's kind of been the main focus historically. This you take, like say Dan may have 2,000 patients. Let's look at all 2,000 at the same time, which you can pull out electronic medical records nowadays and say, okay, out of those 2,000, who should get screened, who hasn't get screened, how are we going to reach them? And we can use email reminders, text messages, phone calls, put in a process in the clinic, so when his nurse checks the patient in and says, oh, you need this, so you have extra people mentioning that to them. It could be front desk or a care coordinator. And so different roles in the clinic changed to make it work better.
So for our viewers out there, how would you sell the urgency of a program like this?
Well, the urgency is that obviously there's a need to have these screening tests done. They've been shown to help improve health and longevity and of course the complications due to these diseases. So the urgency is out there to do it. So, and I think just having the clinics be aware that this is necessary and to help them through that process is very important. And in fact, they'll probably see something different. Instead of coming in and say, do I need this? They'll have the question asked, would you like to do this because we recognize that you haven't had it done? That's a little bit different focus in medicine, especially in primary care.
Yeah, it's kind of a prevention focus too, is that colon cancer is probably one of the most easily detectable early cancers there are. And there's already a lot of studies showing that the earlier you catch it, you'll save people's lives and even save money actually. Because if you catch it in a small polyp stage, it's much easier to treat. It doesn't require the extensive surgery, radiation, chemotherapy, things like that. So if you can catch this early and there's such a good screening test for it, you could really save lives and money.
You received a national award recently. Can you tell us a little about that?
Yeah, well, there's what's called the National Colorectal Cancer Roundtable. It's part of the American Cancer Society. They've been trying to get places around the country to start working on this and recognize them if they've done a good job. And so there's a couple groups throughout the country that they recognize, and Lincoln was one of those this year.
What can other communities learn from a program like this?
Well, I think one is if you work together. I mean, we have actually competing health systems working together on the project. One Health Nebraska, which is an independent group, the Physician Network, which is part of Catholic Health Initiatives, Bryan Health. We have multiple groups all working on the same project at the same time, and when they do it together, it's better for the community.
I think the key is the way we do it is the same. Patients are the same, the goals are the same, even though we have independent, different groups and stuff we belong to. The goal is to have a healthier Lincoln and a healthier surrounding areas, and when we all work together along those lines, we can do great things.
So where's the future headed? What are you guys up to in the future?
Well, we're going to kind of use the same method for other stuff, so not just cancer. So we've got really good rates for breast and colon cancer screening now, and we hope to maintain those. And so we're moving on to 2 other projects. One is around HPV vaccination, which is actually a vaccine to prevent cancer, and that's focused in adolescents. So if we can get them that vaccine, it'll prevent cancers later in life. The second one we're focusing on is diabetes, because it's such a highly prevalent disease. There's a lot of people with diabetes, a lot of healthcare. Like an example I'd use is a local employer, all of their healthcare costs for all of their employees, about 15 to 20% of it's tied back to diabetes. And so if we can do something about diabetes, we can eliminate a lot of unnecessary suffering and costs there too. So, and then Dan's clinic's going to start working on that this year.
And a lot of the same processes are already in place, so we can see using the same types of methods in our clinic, the same people, the same ideas, and just rolling those from breast cancer and colon cancer right into diabetes, HPV, whatever process we do as we go along. And we think it'll be quite successful. And the clinics are excited about it. They're very pleased to receive the award and see the fruits of their effort.
Thank you guys. Thank you for all the work you're doing, and good luck in the future.
Thank you.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for a Healthy Lincoln wants you and your family to live longer, healthier lives. It's easier than you think. Walk the dog every day, play more, and text a little less. Swap out a sugary soda or energy drink for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. Learn more at healthylincoln.org.
Hello, I'm David Humm with the Lincoln-Lancaster County Health Department. I'm also a member of the Lancaster County Crusade Against Cancer. March is Colon Cancer Awareness Month, a national campaign to increase awareness about colon cancer and to spread the message that it is preventable, treatable, and beatable. Colon cancer is very preventable and can be found through screening tests, yet it remains the second most common cause of cancer deaths for men and women in Lancaster County. If you're a 50 or older, you should be screened for colon cancer, although people at higher risk for developing colon cancer, such as family history, should begin screening at a younger age. Please talk with your doctor when you should be screened. To improve screening locally, the Lancaster County Crusade Against Colon Cancer has been encouraging people to get screened by distributing free colon cancer screening kits. Free kits are made available at participating pharmacies in Lincoln during the months of March and April. Please take the time and take advantage of this opportunity to get screened, or share this message with friends and family to encourage screening. For more information on colon cancer screening, or where you can pick up a free screening kit, visit lincoln.ne.gov, keyword colon cancer. Take the time to get screened.
It's so great that the parks are tobacco-free zones now.
I know it's so much cleaner and healthier for the kids.
Yeah, I agree.
Excuse me, ma'am. Would you mind not smoking so close to the park? It's a tobacco-free playground. Thank you.
Play cleaner.
Play healthier. Play tobacco-free. Play tobacco-free.
Hi, I am Melissa Fuller with Shape of the City, and I am out at a lovely greenhouse here, and I am with Mike Shambaugh-Miller with Produce from Our Heart. And let me know a little bit about what is Produce from Our Heart.
We're a local nonprofit. We've been around for about 3 years now. What we focus on is working with farmers, home gardeners, other organizations that grow produce either in large amounts or small amounts, particularly farmers markets. We then, if they have extra or produce that they're going to be getting rid of, we bring in volunteers, we collect that produce, and then we redistribute it to pantries, homeless shelters, food banks within range of that farmer's operation, so they know they're helping their own community. What we've been able to do is to take the idea of there is a lot of excess produce that is grown, and unfortunately, due to marketing efforts, due to overproduction, due to storm damage, a lot of that produce does go to waste. But the problem is, how do you get it from where it's grown to where it's actually needed? And right now we're the only group in Nebraska that acts as that bridge, trying to get it from point A to point B, if you will.
So talk about your reach. Where are your efforts located right now?
Our major focus is in what I would term southeast Nebraska, so basically Highway 81 to southwest Iowa. We do cross over the river, and from I-80 down to the Kansas border. That's our main focus area due to limitations we have on ability to transport. Right now we're one truck and one trailer. But we do actually have operations or donors up in Harlan, Iowa, who donate to us on a fairly regular basis, about once every 4 to 6 weeks. And then we also work twice a year with the Elkhorn River Valley potato growers up in O'Neill, Nebraska. We'll go up there 2 days out of the year and pull out over a 2-day period. We'll pull out probably around 25,000 pounds of potatoes. So we do end up distributing, I would say probably over 80% of our produce comes back to Lincoln, and maybe another 5–10% ends up in Omaha.
Wow, that's an impressive project. How does it work? And I mean, in terms of what part of the year are you going year-round, or are you just going parts of the year where you have the heaviest harvest?
It has turned into a year-round operation, though you're right. Once about late May, early June hits in Nebraska, then we're busy every other day up until this year. We went until the 3rd week of November that we were still harvesting.
So what impact have you seen so far on the other end where it's being received?
We did receive the Homeless Coalition's Donor of the Year award this year because of a relationship that we've built with the Gathering Place down by the Capitol. The produce that we provided to them this year, they told us that for the first time in the history of their organization, they had fresh produce every night from May through November for their meals, and they've never been able to do that before. So we know we're helping at that level. We've brought produce in for the food bank here in Lincoln. A lot of our larger loads, when we do get into that 7,000 to 10,000 pound range, the smaller organizations, they'll take 200 or 300 pounds, of course. Food bank's able to move those thousands of pounds for us, and I know that a lot of our squash this year and a lot of our potatoes this year ended up in all 14 counties of southeast Nebraska through the food bank. And then again from here at Yankee Hill, they donated all of their pumpkins, both pie pumpkins and jack-o'-lantern pumpkins, the week before Halloween. They decided they were done selling for the Halloween season. They let us come in with volunteers, and we took out, I believe it was about 1,800 pounds of pumpkins, and we distributed them to 2 local grade schools. And so we had that wonderful opportunity of unloading the trailer, setting out 200 or 300 pumpkins, and then letting these grade schoolers come out, and each one was able to pick up their own pumpkin. It was at Clinton Elementary, and it was just unbelievable to see that level of what we do, that level of appreciation of even the small child to the elderly that we serve.
How would you really explain how important a project like this is?
This is the visual I use when talking to groups, is that we throw away enough food in Nebraska, this is edible food, that we could fill up Memorial Stadium 28 times.
Wow.
And of that, that means that if you drop that down to edible produce, that means that about 10 stadiums full of edible produce gets thrown away in Nebraska every year. Now granted, some of that's bananas, which we don't grow, but when we look at what we're throwing away just from Nebraska production, we're looking at probably in the range of 3 to 4 memorial stadiums that are coming just from farms, community gardens, and individual gardens in Nebraska. Flip that around to where we have some counties in the state where 1 in 3, 1 in 4 children are considered what's called hunger at risk, which means that at least once a week, 1 day a week, they don't know if they're going to eat or not. The state average is 1 in 6 kids. And then if we look at seniors, we see in some counties it's 1 in 3 and scary 1 in 2 seniors our hunger at risk, therefore not knowing where they're going to get their meals during the week. If we can impact those kind of numbers in any way with fresh, nutrient-dense vegetables that a lot of these families don't see either during the summer or during the winter. And therefore it's something that their diet drastically needs. And if we can make that easier for these parents, we're not just helping that family. In the long run, we're helping the community, because these kids are going to do better at school. If they do better at school, they're not going to be dropping out. And it's been shown in numerous studies that if children have a well-balanced diets, that they are more successful as adults. And so it's an investment in the community. And with this kind of an operation, it's a low-cost investment. I have difficulty with donors sometimes. When I show them, they're like, well, we need to see your budget. And so I show them my budget, and my budget is gas. It's a very limited input, if you will, to get a massive output.
Our average viewer out there that's not a farmer, what can they do? What difference can they make?
Even on the individual level, we harvest fruit off of a lot of fruit trees around Lincoln that are just a tree in someone's yard. Off of one average apple tree or one average pear tree in Lincoln, we're pulling off about 300 to 400 pounds of fruit every season. And so even if you just have a tree in your yard, you can still call us. Nice thing about that is we come out and do the harvesting, and we leave behind as many boxes as you want to keep for yourself, and then we take the rest. Individual gardeners, we're more than happy to swing by and pick up a sack of cucumbers, a sack of tomatoes. Also, Campbell's Nursery here in town at both of their locations. During the growing season, they offer what's called a Grow and Share program, which is you can drop off produce at their location every day of the week, and then we swing by there twice a week to both of their locations, and we pick up that produce from them. And what we ask is that, like the Campbell's Nursery program, the Grow and Share program, you plant an extra row of something. Doesn't matter really what it is, we can use everything. Or plant a couple of extra plants in your garden, and know that you're going to dedicate those to just donation. Also, individuals who don't have that green thumb, there's a few of them out there, we definitely and desperately are always asking for help. As I said, we travel all over southeast Nebraska into southwest Iowa and as far away as O'Neill. Eventually we'll be statewide, so we need those volunteers in different locations. We do help cover the gas money if we need to take volunteers further away, such as if we go up to O'Neill, we'll take a van load or a couple of truckloads of people up there. We'll help cover that gas. If you want to drive down to Nebraska City and help from, say, Omaha or Lincoln, we help cover those costs. And then, as this operation shows here at Yankee Hill, we're right on the southeast side of Lincoln. It's a 15-minute drive from downtown. We're out here a couple of times a year, so it's an easy drive. And all we ask is a couple of hours. It doesn't take a lot of time, it doesn't take a lot of people, but it does take people and it does take time. And so you can't grow, you can help pick up. And that's a huge issue for us also. If you want to look at the dollar value of what we're bringing out, this last year we finally broke 100,000 pounds. It was our third summer. That was our big goal. But if you turn that into dollar amount, that's over $500,000 in produce. And we did all of that this year, believe it or not. We did that this year with $1,500. 1 pound of produce turns into 1 pound of methane gas. And methane gas is the largest contributor to global warming, to global weather change. And it takes 7 gallons of water to grow 1 apple. So if you throw that apple away, you're throwing away the water that went into it, you're throwing away the time the farmer spent, you're throwing away the cost of the fertilizer, the cost of the fuel used to go back and forth to the field every day. You're throwing away all of that money when you're throwing away that produce. So there is no win in it unless that produce is maybe turned into composting.
This is part of our March show, and the hope is that maybe people are making their plans for the rest of the year. How do they get a hold of you if they want to be part of the solution?
We're found online at producefromtheheart.org. You can find us at email at producefromtheheart@gmail.com, and you can find us on my phone at 402-304-5710.
Well, thank you so much. It's an amazing project, and hopefully you'll get some more people out there to help.
I hope so. This helps a lot because the big thing is, like you said, getting the word out there. We're a strange beast here.
Yeah.
A lot of people don't understand what it is we do or why we do it. So the more and more and more we can get that message out there, the busier and busier I hope I'll be.
Shape of the City is dedicated to keeping Lincoln informed of health and wellness programs and events. Visit our calendar at lincoln.ne.gov, keyword Wellness Calendar. If you'd like to see your program or event covered, email us at LNKTV Health at lincoln.ne.gov.